Hi, good morning everyone, and welcome to today's video. I'm Mary Felling, physical therapist, and today we're going to be working on the iliacus. This is a really good treatment technique for those of you who have back pain, for those of you who have hip pain, anything through the pelvic floor. This is really going to help you. If you are pregnant, this is contraindicated, but once the baby is born, then you can start doing this exercise. All right, let's get started. In today's technique, you're going to be using a Theracane, and if you go into the description below, you'll see a link to purchasing a Theracane. So in the meantime, you can watch as I use the Theracane on the iliacus. To find your iliacus, go to your hips, put your hand on your hips. You know where the top of the bones hit, so here's my waistline. And then right under it, I can feel the top of the bones. From there, go down to where you feel those two bones in the front and go right inside that. So it's almost like if I was trying to slide inside the curved part of the bone. So I'm not going in this way with my fingers. I'm actually going back and out. That's my iliacus, right in there. And once you're in there, you also know, because it doesn't feel real good, it's a little harder to get into it when you're standing than when you're lying down. That's why we lie down, let some of the tissue get out of the way. But you're on it. If you're going down and you're in your groin, you're too far down, come back out of that groin a good maybe. So here's the start of my groin. So the iliacus is about 1.5 inches or so above that. And you should be able to feel that hip bone in the front, and you go inside of it as if your fingers are going along the inside of a bowl, and that's your iliacus. All right, so in your position that we're going to be in, which is on the back, you go into it slowly, especially if you've had some back pain, if you've had some hip problems. You know, you never know what kind of position is going to be problematic or easy for you. So you always move slowly, and you can take your Theracane. You could take any edge. I can use maybe just one of these short pieces off the shaft of the cane. You can use the edge of the cane. I'm going to use the bottom here because it's simple for me for leveraging the Theracane and weight of the Theracane in. So all you're going to do first is look for, you're feeling for anything tender or tight. And I immediately feel like I can hardly get in there. It's so tight and it is uncomfortable. So I'm going to stay there. We're going to start our 5 minutes. I'm going to angle a minute just to see, because I want to get the angle that produces the tightest feel or the most discomfort. That's the angle I want to work on the iliacus. So this is a John Barnes protocol, so John Barnes Myofascial Release approach. And in that protocol, you always use a minimum of 5 minutes of mechanical energy into the body to get a electrical flow going. It's called the piezoelectric effect. And that piezoelectric effect moves along the fascia. Fascia is kind of like the copper wire in our body. And at 5 minutes, that electrical flow is going. So that's why you want to make sure once you're in a position, you don't get distracted. You don't have a cat brushing by your leg, because you need to stay there. And the minimum is 5 minutes. And that's what we'll be doing today. Follow along with me for those 5 minutes. But after 5 minutes, you can stay there as long as you want. And I would really encourage you to do a good 8-9 minutes minimum on any spot, so you can affect a change in the fascia. So what happens when fascia is injured, and it can be injured by overuse, repetitive use, straining, it can be tightened down because you've been in a shortened posture. Maybe you sit a lot. That would really shorten this iliacus muscle. And if you sit a lot and it's shortened, it tightens up and creates pulling through the rest of the low back and the hip, which why this one contributes to low back and hip pain. And so as you're there and we're waiting for it, when the body goes through any kind of overuse, repetitive use, that's an injury to the fascia. So the fascia binds down, it tightens, and it can put up to 2,000 pounds of force per square inch in that area. So when it does, it's tightening around all these pain-sensitive structures like the muscle itself, tendons, ligaments, nerves, blood vessels. All of those are pain-sensitive. And when it tightens down, we call that a myofascial restriction. That myofascial restriction is crushing those poor little structures in there, causing pain and stiffness. So we get this piezoelectric effect going after 5 minutes, and that electric flow, that piezoelectric effect goes through the fascia and comes to this area where it's bound down and dehydrated and sticky and gluey, that myofascial restriction, and it helps rehydrate the area. It helps to elongate and taking those crushing pressures off of those structures. So we're in 3 minutes of our 5 minutes, and again, I'd like you to continue to work on yourself for at least maybe 3 or 4 minutes after this 5-minute period. And this iliacus is one of the hip flexors. The other major hip flexor is called the psoas, and together they're known as the iliopsoas group. They're both hip flexors. And so this technique is really good for helping professional dancers, track and field folks, anyone who's doing a lot of kicking the leg up, keeping the knee up. When you're in here, you're feeling for a release. So when you first press in and you find a spot, you found the spot because you're either tender there or it's super tight. It just feels like a rock. And if you're working on an area that felt like a rock and no pain, that's a good spot. Eventually those do become painful because you've gotten enough tension released out of there that those little sensory nerve endings can now pick up information like pain and send it to the brain. And what you're feeling for, once you're on a fascial restriction, myofascial restriction, you're feeling for a release. Now, release feels like less pain in the area, softening, warmth, elongation. It might feel like butter melting or taffy pulling. Or you might be here and feel a radiating symptom going up into your chest, across your abdomen, maybe even down to either leg or to your low back. Then a release can also feel like a sudden relief of any radiating pain. So like I kind of feel this coming up into my respiratory diaphragm in here. So, and I have one particular spot. So if that spot starts releasing or feeling better, then I know I'm getting a release down here. Does that make sense? We're working here, but because the fascia is one complete strand of material. All right, we're way past 5 minutes, but as I said, you could go as long as past 5 minutes for sure. So very slowly, when you're done, you're going to take the pressure out very slowly. Put your product next to you. You're going to come up, kind of roll like a log, arms, head, chest, and knees all together. Come back into your original position. And then feel. What do you feel? Can you breathe deeper? Can you sit taller when you go to stand? Are you standing taller? Do you walk a little different? Remember to keep doing these every day for 14 days and then continue for 2 or 3 times a week after that to maintain those positive changes. Thanks for watching, and I'll see you in our next video.